Hello and welcome to this virtual roundtable, International Perspectives on COVID-19, Alumni Voices from the Field. I'm so humbled to have you all joining in today. This is a milestone event for Teachers College to be hosting a global discussion of 6 alumni who are all joining in simultaneously from their home countries. I'm so proud of our TC alumni coming together in these uncertain times. And I'm especially grateful to each of you for taking time from your hectic days and nights to join us for this conversation. As of March 30th, there were over 780,000 worldwide confirmed cases and over 37,500 deaths. Cases of COVID-19 have been recorded on every continent. These are truly unprecedented times. Many unknowns remain, and yet there's one certain truth that rings out from this universally shared experience. We're all in this together. At the onset of this global crisis, I began to hear from alumni around the world who were checking in and sharing their experiences. We thought it would be meaningful to bring together a small cross-section of TC alumni who are living and working in some of the most notably impacted regions of the world to share their own personal experiences, not only with each other, but also with the greater TC community. Joining us today, we have alumni from China, South Korea, Italy, and from within the US in San Francisco and New York City. So let's start with a round of self-introductions, moving from the west to the east. Let's go to San Francisco.
Hi, thank you so much. My name is Joanna Brody. I graduated from Teachers College in 2011. I studied elementary education in the Department of Curriculum and Teaching. I am an elementary school educator and a mother of 2. I have 2 young children. And currently I am a supervisor with the Bay Area Teacher Training Institute, also known as BATI. And I work with teachers who are in a master's and credential program, working full-time and earning their degree as well, simultaneously.
Great. Thank you so much for being with us, Joanna. I know it's very early out in San Francisco.
Thanks for having me.
Okay, so let's go to New York City.
Good morning. My name is Jeffrey Putman. I have a doctorate from the Department of Higher and Post-Secondary Education at Teachers College, and I'm currently the Vice President for Academic and Student Affairs at the State University of New York's Downstate Health Sciences University in Brooklyn, New York. And on our campus, I coordinate the services for students, enrollment services, and I'm the Deputy Chief Academic Officer. And we also have a hospital on our campus, which was one of the 4 hospitals in New York State that were just designated as COVID-19 only to take care of COVID patients in New York City.
Wow. Thank you for being with us, Jeffrey. So now we'll look to São Paulo, Brazil.
Hi, everyone. My name is Leticia Laio. I'm in São Paulo, Brazil. I started a company last year that has an online learning platform support for in-classroom teachers, as well as a school that opened on February 10th, was the beginning of our school year. Then we had 2-week classes, a week of carnival, and then the crisis started here in São Paulo. So there have been so many challenges on this situation specifically, not only as an education provider, but also as a school.
So now let's go over to Rome, Italy.
Hi, everyone. My name is Vasily Popov. I'm a TC graduate from 1995, so it's been 25 years ago. I got a master's degree in administration of higher education. And throughout my career, which seems like light years ago, but also like yesterday, I kind of gradually shifted from education into profit and then non-profit. Now I'm working for the United Nations. I'm the Deputy Director of the Office of Strategy, Resources, Planning in the Food and Agriculture Organization of the UN, which is headquarters in Rome. And I also switched from administration into more budget planning, strategic planning, RBM/number crunching. So it was an interesting experience. Looking back at what TC taught me, I was actually talking with my son about it because actually what you remember 25 years later is the skills, less of a knowledge, because knowledge changes so much. But it's more about how to study quickly, sponge up 2 or 3 books in a week, and put it to good use. So these are more skills. That's what I value most, which we obtained from Teachers College.
Excellent. We'll hear more about that, I'm sure, in just a moment. Let's go now to Shanghai, China.
Hi, good morning, everyone. My name is Kevin Jian. I got my bachelor degree from the University of Toronto in mathematics. And then in Teachers College, I was working with Dr. Ginsberg, and I got my degree in human developmental psychology. After graduation, I was working in the Korea International School in Pangyo, Korea. And then I returned to Shanghai to work in my own international school in 2017. So right now I'm working at the international school, and my father is the founder of the school. And right now I'm working as the facilities director.
And last but not least, from Seoul, Korea.
Hello, hi, I'm Juhi Song. I'm a class of 2013. I studied instructional technology. So I got a master and doctorate degree at Teachers College, Columbia. Before that, I studied at Ohio State University for TESOL, teaching English to speakers of other language. And I've run the Center for Education and Technology from 2014. It's a private academy for K-12. And then I had a vision to open up the international school. So finally, we prepared everything, and we were just opening up the school in March because of the COVID-19 is getting delayed. So the teachers and the facilities, the interiors are just ready and waiting for the kids. And I served as a president of Teachers College Alumni Association of Korea from 2016 to 2019. And also with a great honor, I've received Alumni Award for Outstanding Service at Teachers College in 2019. So before wrapping up my introducing myself, I feel so heart-touching, because think about that, with just one heart we got together from all of the world. And also I feel very honored. I can see all of you are working for a very important position in all of the world. So really nice to meet all of you.
So let's kind of go around and talk about how has COVID-19 affected you? How has it affected your home life, your work life? And I know, Kevin, you started out by saying, one of the really key things of your job is making sure that you're keeping a safe and germ-free environment. So tell us a little bit more. Being in China, what was that like as the initial news was coming out? How did Shanghai react as you were watching news from Wuhan? And just tell us what your experience was and how you've kind of maintained the course since then.
All right, so I want to give you guys a bit of the timeline of the things that have happened. So on December 20th, a doctor, Dr. Li, he was an eye doctor who was working in the Wuhan Central Hospital, and he was known as the whistleblower of COVID-19. He was the first person who sent out a Weibo, the Chinese Twitter Weibo article, to alert people that there's this new virus. But he didn't know what the virus was caused. So he just said 7 cases of the new SARS were confirmed, and those patients were all in contact with the Wuhan seafood market. So I believe you guys have all heard about the Wuhan seafood market. And he warned people about that this virus is dangerous and it can be spread from one human being to another. But on January the 3rd, he was brought to the police department and he was penalized for spreading rumors. Like, no one believed him. So he got penalized. But it turned out he was not spreading rumors. He later died on February the 7th from COVID-19. So by this time, still not many people knew about this. And finally, on January the 20th, this is when the time people first in China heard about COVID-19. So I don't know if you guys have heard about Dr. Zhong. He's like the virus hunter of China. So Dr. Zhong, he went to Wuhan, and on the press conference, he confirmed that this virus can be spread from one human being to another, and the spread cannot be controlled without intervention. So this first alert everyone in China. It was on the news. So on January the 21st, everyone was nervous, and I was nervous myself. I go to the gym every day, but on that day, I felt like really unsafe at the gym. So on January the 22nd, rumors start going around, and my friends are saying, some of my friends are working in Wuhan, and they're saying that people are telling them like you should leave Wuhan because the city will shut down very soon. But no one believed that because no city has ever shut down in China. And on January the 23rd, city of Wuhan was shut down 10 o'clock in the morning. So that was how we first heard about COVID-19 and how what the time was for the city of Wuhan first to shut down. And I just want to share some numbers with you on like how the development of COVID-19 was. So from February 1st to February 15th, there was an average of 2,000 to 3,000 confirmed new cases every day. So, and after the 15th of February, the situation was pretty much under control, and the number of new cases went down to under 100 each day. So like 80, 70. But also around the 20th, February 20th, in the city of Shanghai, there was 0 new cases. So all the new cases in China were coming from Wuhan. And since then, I think by the end of February, all the new cases in China were like imported cases, are the foreigners. So we have very few new Chinese cases.
Right.
I'll talk a little bit about how it has affected my school and what the teachers and principals had to do. So it was right at the spring break when this happened, and many of our students and teachers were not in China, and they cannot come back when this happened because their borders shut down. So for example, we had teachers in Spain who were trying to come back, and they got stopped at the airport and they couldn't come back. And we also got students who were in Canada, and it was advised by the travel department of Canada not to travel to China. So right now we did a survey, and about 80% of our students and teachers are in China, and the remaining 20% are still overseas.
Wow.
But so even after the spring break, the government said the government shut down all schools and all business. So everything was shut down, and we still didn't hear anything from the government that we are allowed to open our campus anytime soon. And for what I do as facilities manager, we receive the guidelines from like the Chinese CDC. We communicate with them daily, and they have a guideline for us on how to disinfect everything in the school, like the doorknobs, the elevator, the stairs, the floor, the cafeteria, and what we use. Like, for example, we use chlorine for wiping the tables, and what concentration we need to use, what we need to do to disinfect the toys in our early years program.
Wow.
So I've been busy with that.
Absolutely.
And, yeah.
And so despite the fact that a lot of business has resumed in China, your schools are still closed?
Yes, so we are under the Shanghai Municipal Education Commission, and they have shut down all schools, and not only international schools, all the public schools are closed now. And still there are many businesses that are closed. For example, the karaoke, the movie theater, the gym, and other places with a lot of people gathering. Those places are still closed, but companies are open. They're operating.
Right. Well, you said earlier that you go to the gym every day. How have you managed to maintain your working out regimen in this time?
So lucky for me, I live in the house and I bought the equipment I need to use.
Great.
I bought a chest fly and everything I need.
Fantastic. A home gym. Good for you.
Yes.
It's important to stay physically active to keep our minds from just really running away from us. So we're going to turn to Juhi in Seoul, and I know there was many headlines in the US. I don't know if this was a similar situation in other countries, but you know, there was much alarm at the very onset of South Korea beginning to report their cases because it was such a high number. But in fact, it's because South Korea was doing such a phenomenal job of really testing as many patients as they could. So it seems like from the international news, Korea has really handled this well. And when you consider the number of cases versus the number of deaths comparatively across the world, South Korea has really seemingly done a great job. So what was your experience like, Juhi? Tell us what it was like to be in Seoul in this very scary time.
Okay, thank you, Rosella. Like Kevin, I'll give you the timeline. So just before this meeting, I just studied about the data, like from when to when. So I realized that I would say that in Korea, I don't know, other countries will be similar or not, but in Korea, we would say that there are 3 stages. So first is from January 20th. That's the date the government reported we had the first infected COVID-19 patient. So that was January 20th, and up to February 20th, it's about a month. I would say that was a smooth period. So with the first infection, the number of infections grew slowly, like one or a couple of people increased every day. So mostly it started from visiting Wuhan, China. So as you know, Korea and China is close. So those first infected people had an experience visiting Wuhan. So we thought just, because of that area, it may happen, right? But the second stage happened that made us freaked out. It was from about February 20th around up to March 20th. It's interesting, it's about a month. So suddenly increased hundreds the people overnight. So that time was the last week of February, which was a very scary week to most Korean people. So, but again, so the reason it happened, the area was called Daegu, as far as south area of Korea. And then there's a religion, Christian people, it's not straight, it's a pseudo, Saibi, the religion. So those people, the way of service, so 100,000 people got together in one place. That church has a branch office in Wuhan, China. So there were, the people is connected. So after that is about a month and 100. So that period of time, many people ran to the grocery and buy food. And after that, I would say the March, I would say became reduced quite a lot. So, but currently it's increasing a little bit more again, mainly because of the returning students from the States. Because as you know, we have many children and students studying in the States, but in the United States, they close the school, the dormitory, so they had to come back. So that's why. So when there was the first steep rise in increasing number, so even my husband went to the grocery and bought a lot of noodle. But interesting thing is that it didn't continue that long. So some news, abroad, they say, Korean people, not many Korean people are not freaked out. They don't buy the food in the grocery. I think I've thought about the reason. I can tell two reasons. First, Korea has, I think, a good distribution and delivery system. So when there was no food at the grocery, people were panicked. But the next day, food again. So it's a field at the grocery that made people, so relieved. And second, as you know, Korea experienced the war in 1950. So, as you know, there was a war between North and South Korea. So it became divided country. So still, our parents' generation, most of them still are alive, and they experienced a war themselves. So they survived from the starvation. So they know how to get over. And also, they worked so hard to develop, the country. So we share the conversation with those generations. So, and even now, we often hear the news that North Korea is trying to invade and shoot a missile so often. So it's nothing new, so often we hear the news that North Korea shoots a missile, like that. So we came to just used to the pain. So I think, so mostly because of that, we don't run to the grocery. Right. So about the government, so many Korean people think the current, the president, the government shouldn't have allowed the people from China at the beginning stage, especially from Wuhan. But, this government allowed. So we are a little bit angry about that. But thanks to the high level of medical service and checking, testing kits, and many volunteer doctors, nurses, and people, I think we could reduce the infection fast and, going through well. And about my working place, as I told you, I still cannot open up the new school. But the thing is that my teachers are just still there. So that means I still need to pay the rent of the building and also give the payment to the teachers, right? So at the beginning, I couldn't think about it could, go along like this. So I encouraged the teachers, it's okay, we can prepare more and it will be ending, right? But became no longer. So to be honest, a couple of weeks ago, I was thinking about giving the unpaid holiday to the teachers. I had to make a decision, but I decided to just to give the regular payment to the teachers, because if I do that, and then, between the financial burden and side effect caused by teacher psychological stress. So, I chose, just to just go that way. So as Kevin said, I clean up, every day, so just to prepare a lot. But, I think that's what I'm doing now.
Yeah.
Yeah.
And you have two boys also at home, right?
Yes. My first son is in 12th grade. So it's just right before going to university. It's a very busiest moment in Korea, but he's going to public school. So all the public schools are closed from elementary up to high school. So he, doesn't go to school. So government doesn't allow every school, public school, open. So up to April 9th. So which means they have to stay home. And my second son is going to international school. So international school, they are providing online courses. So he's taking online courses. Yes.
Wow, so the public schools are not providing any
Not yet.
for, wow.
Not yet, but they are working on it. So the government said from April 9th, so from the high schoolers, they are offering the online courses.
Thank you very much for sharing, Juhi.
I just want to add a little bit to Juhi that I want to tell her that our school is going through the same thing. So as an international school, March is the time when we send out the re-enrollment letter to students. And it's the time when tuition come in. Now, this is important because the cash flow wise, we use that money to pay teachers' salary starting from April or May. Now, because of the crisis, we were not able to send out the re-enrollment letter to the students. And I've had a call with the admin manager of the Korea International School, and they are facing the exact same situation. So it's also the same for many of the business in China, because they are dying because they are not able to afford the rent. And this time the bank is not going to help you because everyone right now is going to the bank asking for a loan to pay for their rent.
So let's move to Rome, Italy. Tell us more, Vasily.
I think we are on week 5 of the quarantine, or week 4, week 5, I think. I used to draw on the wall, like they do, little sticks and counting weeks. I gave up a while ago.
What is time? What are days?
Time doesn't matter anymore. But we were waiting, will it ever start working? And it looks like quarantine is working. So I have my fingers crossed here. Just to follow the example of Kevin and Juhi, to give you a little perspective along the timeline, in Italy, we were kind of following these developments in China and then in Korea, and we were so far away. And things are normally under control. We had a few hiccups before that. So no one in Europe, I think, took it seriously, as we see now. So, but at the end of January, Italy closed all flights with China. That was already too late, but that's what we did. And we declared a state of emergency. But we did not really stop schools or told people to work from home, etc. And then Italians, one of the big things is social distancing. That's what helps you to avoid getting infected. And it does. Social distancing does not exist in Italy. It's the opposite. They hug each other, they rub shoulders. Any of you who went in an Italian restaurant in Italy, you would see these tables all together. You move and you touch your neighbor right away. They have regular dinners with their grandparents and great-grandparents. Every Sunday, you have a pizza night with your family, the whole family of 50 plus people. They also so I could kind of see that any contagious disease like that would hit us hard. At the end of February, everybody in Italy, the schools closed for a week, everybody packs their skiing gear and they go north. They go skiing in the Alps. It's a nice, it's warm and it's snowy, and then you go down the mountain and then you have an aperitivo, you sip something nice, then you do another round, you rub shoulders with another 200 people. And the week before that, we don't have a patient 0, but we have a patient 1. And this patient 1 lived in the north of Italy in the skiing area, one of the popular ones. And this person was very active, a good sportsman. So he got infected as a tourist in another country. And then he came back, he rubbed shoulders with everybody, had like 5 social dinners, ran 2 marathons, and the whole thing exploded. So at work, we're talking end of February, we started seeing this weird news. They closed off the north of Italy, so they quarantined them. I'm from Rome, which is the central part of Italy. We were still thinking we would be okay. Around the first week of March, I work for the UN, so there's lots of responsibility on us because we have to be the best. You cannot be like a local. Like when I drive, I don't break the driving rules, even though everybody breaks the driving rules in Italy. You know, we have to be careful to set the right example. So we follow the situation closely, and we started getting these signals that we will have to dust off our plans for an emergency, and we will soon be working from home. And I was part of the skeleton staff, like Jeffrey right now. So I was, like most of us were working from home. I was still wearing my tie in an empty office, and occasionally doing a quick rush to, to the hand sanitizer thing and back. And then from March 9, we are working all from home. And it's very difficult for the country. I sympathize, Juhi, because people, especially self-employed people, many of them lost their jobs. Those who are working in private sector, I can't even describe how tough it is. I have a friend who's a cab driver, and his wife runs a small enterprise, and she had to make really tough choices, like what Juhi was describing. Should I send everybody in unpaid leave or try to keep them in? So it's tough. And so we are very privileged and lucky, those of us who can telework from home and get their salary paid for the day that you're teleworking. Speaking of experiences, now that everything is shut down, and Italians are really good. I didn't expect it. There's social distancing everywhere. People get really angry at you if you come closer than 2 meters, and we're in Italy, so it's good. We have these lines to get in the store. Everything is in stores available, so no problem. Toilet paper, we didn't have any shortages, and I have my theory. Once a TC alumni, always a TC alumni. So I always have, even though now I work in strategy planning, resource management, I always, my ears go like this when I hear something related to education. So my colleagues were describing to me their experience. All the international schools, they are working remotely. And actually some public schools are also doing a good job. They're using the tools which are available out there already. There's a cartoon going around which says, it looks like a questionnaire, which says, who prepared your school best for teleworking? A, CEO, B, CAO, and C, COVID-19. So that's what's happening. COVID-19 actually really kicked up a notch the distance learning. I think Joanna said that she's in distance learning field. You mentioned something related to learning, working and learning simultaneously, which may involve distance learning. So these things are picking up even in public schools. International schools, they did a really good job. And all my employees sitting at home, they're wearing 3 hats. They're teleworking, they're being a parent, and they're also being a teacher, because remote learning is not always a straight shooter, no matter how old or young the kids are. So this is something I'm sure TC is really exploring now and studying, because it's a huge opportunity to now is the good time to invest and to really look seriously at distance learning, what we have, how the tools, which tools are good, and how we could make it even better. Also the legislative side of things, and how to make the public schools sort of embrace this. And one last thing, my work, what I think Juhi was describing it. She was saying that in Korea, it's important to maintain the food distribution. That's what, and this Korea maintained it nicely. And this is what we are trying to do now. Well, we can't do it personally, but we're encouraging, and this is what we're following closely, is maintaining the same food chain distribution all over the world, because certain countries now, they may have too many issues at home, and they may decide to close the trade barriers or put up trade barriers. And this shouldn't be happening. We have a lot of food in the entire world. The food is there. It's actually a really good year. And this is the message that we are trying on the policy side. We communicate with the heads of state, and every state is now preparing some sort of a policy or an advice on what they plan to do, how they address the COVID situation, and food is part of it. I mean, the health of people and the food is the second next choice, and the two are interdependent. And that's where we come strong, and this is also an opportunity to make things better. So it's horrible what's happening out there, but it's also, we should take it as an opportunity to move forward.
Absolutely, yeah. So I'm going to go ahead and turn now to Joanna in terms of the timeline. We started to see cases on the West Coast pop up early, and of course there was, the famed ship that was out in the Bay that was, I think really what put San Francisco in the spotlight in terms of would there be an influx of cases automatically when that ship was brought into harbor. And I think that sort of spurred the situation for you. So could you share a little bit about your experience in the Bay Area?
Sure. Taking everyone's example about the timeline, we have been practicing shelter in place for 2 weeks now. It's been a very long 2 weeks. I feel like every single day the news is giving us new numbers and new information. Our shelter in place initially was until April 7th, and now it's been extended to April 30th. And I think as a mother, it's hard at times and challenging to try to help your children understand why is school closed and how about play dates, or why can't I see the grandparents? But we're also trying to make the most of our time together. And I had emailed with you, Rosella, to let you know how grateful I am that I am a teacher, and I am excited about it, and using everything I've learned at Teachers College to work with my children and understand how to make learning fun and engaging and customized, and also help them learn how to do their Zoom meetings with their classmates and their virtual play dates. And it's really interesting and fun at times to kind of learn together and find out what is Marco Polo, and just this has kind of given us an opportunity to connect with people in ways that we weren't before all of this happened. Professionally, because I am with my children but also still trying to work. In normal situations, I visit teachers and watch them teach lessons, meet with them afterward, reflect on their teaching and their practice, give them resources, and just sort of talk about goals. Since schools closed about 2 weeks ago, I'm working with teachers, of course, remotely. All schools where the teachers who I work with are independent schools and have adopted some form of virtual learning, distance learning, remote learning, whatever you want to call it. And it's been great to check in with them to hear how they've learned to videotape lessons or organize these virtual learning scenarios with their children. And so I was thinking about how I like to hear these stories from the teachers and say, well, you have 20 kindergartners on a call together. Is that challenging? And they'll say, no, it's actually really neat. The little kiddos are pretty tech savvy. They know how to put themselves on mute, raise their hand, wait to be called on. And they've been able to showcase how tech savvy they are. So it's great. I think that it is nice that we're all staying connected and trying to find what this situation has given us an opportunity to do. I know myself with the cooking, and we were talking about grocery shopping. Yeah. I realized just how much takeout we used to do, and now I've become an at-home chef in addition to working and being a homeschooling teacher. So it's been interesting.
That's great. Are there any concerns that the teachers have sort of brought to you?
A challenge for the teachers and their students families, because the teachers work in grades kindergarten through 5th grade, that the dependency the parents have on helping the children with the remote learning, and how the one-on-one support is needed from the parents, and how there is communication from teachers to parents, and how the parents can help with the homeschooling.
Well, thank you very much for sharing, Joanna, and keep up the good work. So we'll go to New York. Jeffrey Putman, tell us how your experience has been.
So I would say in New York, it's actually happened, I guess it's happened fast everywhere, but in New York, we actually had our first case announced on March 1st. And it took until, it's about March 11th that we started making the decision that we were going to have to move classes online, and that happened very fast. So between March 11th and March 13th, so really over a 3 or 4 day period, we completely turned our whole curriculum around. There was some back and forth about, we actually were going into an assessment week for our first year medical students, and from Friday to Monday, we had to change an entire assessment week of in-person assessments, gross anatomy assessments, et cetera, into online assessments that they could do from home. And there was a point at which things were happening so fast that they would literally change in the middle of the meeting you were having. In the middle of the meeting you were having, you would get a directive from the governor's office or from SUNY system administration or someone in the administration saying, oh, you have to change it to this, even though we were planning to go in a different direction. New York actually issued its, what they call New York on pause order on March 20th, which said that all of the non-essential employees had to stay home, although we had already moved most people to working from home anyway, even by that point. And so there's a limited number of people who are coming in to support the academic side of the institution. Obviously, we're also connected to a hospital, and we have our own hospital, which is, as of last week, designated, actually was effective yesterday, is COVID-19 only now. And we're moving all of the patients who aren't COVID-19 to other facilities. Although frankly, as most of the physicians I've talked to have said, every hospital in New York City is basically COVID-19 only, unless it's an emergency. They're basically trying to get you out of the hospital if you can be out of the hospital. And we are getting additional resources in New York. The U.S. Naval ship Comfort did arrive yesterday to add 1,000 hospital beds to the city. And they've built a number of, there's a lot of talk about the tents that they've built in Central Park to serve as an additional field hospital, but they've actually been building those kinds of facilities all over the city. And they're taking over hospitals that have closed that can be reopened. The Army Corps of Engineers has been working very hard with the city on that. They took over a nursing home that was supposed to open this summer, finished it so that they could open it as a hospital. And so they're doing all of that to increase the hospital capacity before they need it, which has been very difficult. But there has been, as Rosella said before, a lot of discussion about how students who are 2 to 3 months from completing their degree can be activated and put into the workforce. So there's, discussion about the bureaucracy that comes with that. How does that affect things like their financial aid, going into repayment early? How does that affect the ability of hospitals to bring them in for training? Because frankly, who is going to be training and supervising these people when they're all busy working on patients, and many of the healthcare workers have also become sick. And so there's a lot of issue with that. And across the United States, there's a variable there's still areas of the United States who, while they're trying to stay at home and do this stay at home stuff, that there really aren't cases there and their hospitals aren't overwhelmed. And so they're trying to come up with national answers that fit both New York, where our healthcare system is very much in crisis and is slated to still get worse. They've said that we'll hit our peak probably in the next week and a half to 2 weeks. So we haven't even hit that peak yet. And there are still areas of the United States that have relatively few cases, but trying to make rules from our accreditation agencies about how to handle getting especially nursing and medical students into the workforce has been intense discussions, because there are places where they're ready and they can take them and they can train them, but I'm not sure that can really happen in New York. So we're trying to figure out how to do that right now. Our state education department has been incredibly flexible, I would say, in terms of, and our regional accreditors have certainly been very accommodating about changing requirements, allowing for online learning, allowing for simulation learning to replace actual in-person learning with patients, and doing a lot of that very quickly, over a couple of day period, changing entire rules of how things are getting done. But I think people are aware of the situation that they're in, and they're being flexible. I would have said before this that there's no way bureaucracy can move that fast, but it has. And as Vasily said, it took COVID-19 to do that and to get colleges and campuses to move to doing this online learning. And I think it'll be interesting as we come out of it to see whether it sticks, whether online learning sticks, and whether we're able to continue in this type of environment.
Absolutely. Thank you, Jeffrey, for sharing your experience. So now we'll look to Sao Paulo, Brazil, and we'll have Leticia Lyle share what your experience has been like since Brazil has started to experience COVID-19.
February 10th was the beginning of our school year. Then we had 2-week classes, a week of carnival, and then the crisis started here in Sao Paulo. So there have been so many challenges on this situation specifically, not only as an education provider, but also as a school. And I can just track back a little bit to what Sao Paulo is going through. I think what Jeff said about how fast things happened in Sao Paulo, it was exactly like that. I think the first registered death in Sao Paulo was March 13th. By March 14th, we sent out the first note to parents deciding that we were going to go into distance learning starting, and that was a Friday. So we sent out a note on Friday saying that we were going to go into distance learning the next Wednesday. So we were going to have 3 days for parents to still organize themselves and come to school. A lot of them were trying to figure out what they were going to do with the quarantine or not quarantine. It took a few days after that for the government to declare it. So we decided to just step a little bit ahead. We left the school open for a few days. Very few students came. And then on Wednesday, we took Wednesday and Thursday and Friday with the teachers to try and launch an online distance learning endeavor. And then our first week was last week, and it was, I think, probably the most stressful week of my adult life, not only for just the whole scenario, which is unbalanced, but like Jeff said, changing to distance learning. We were still, it's the beginning of the school year, so a lot of the procedures, a lot of the first days of school were not there. We're also a trilingual school with a bunch of students who did not speak English, and then continuing that program online with all the challenges of teaching English and still continuing just the obstacles, they were all there. We just dove in. And that happened everywhere. I can see now this week how a lot of schools are still very much underwater. So what we decided last week was to open our platform. So basically we just gave up on our first year revenue, and it's open now. So by next week, we'll have 100,000 teachers on it, which is really cool because it's made for that.
100,000?
Yes, a lot.
All Brazilians?
Yes, they're Brazilians. So the content, the first batch of the content there is in Portuguese, but it's made for project-based learning and you can use that in a classroom doing stations and projects where kids get to go online and research their projects. It has all of the features integrated, and that's what's really cool about it. But we're building the content too, the projects. So we call them expeditions. And right now we have them for early childhood and elementary. And that's what we're opening up. And we're building by June, we'll have middle school content in. But there are 100 people at Camino producing content now. So they're running really fast to get that done. And it's interesting because this was one opportunity that came up, which is we can actually make a difference. Half of those teachers are public school teachers. Wow. Which would not have access to something like this because they depend on districts buying and something much bigger, and now they do. So they're feeling very empowered, which is really cool. And it's been a very busy week. Like I said, I think scenario in Brazil, I think different than, and maybe it's more similar to other urban cities like in New York, is we have parts of town that are not ready for a common cold. Imagine a flu like this. So it's a big battle of fear and resources, and of course in Brazil our government's not helping either, so it doesn't seem like we're very organized. So like Jeffrey said, what I relate is I think people, teachers, organizations organized really fast, like people that were connected to making sure that we are as humans taking care of things, they really organized. I have a group of international schools that I'm sharing all of my practices, everything that I'm doing at school, the calendar. I opened up the yoga and the hip hop daily lessons for everyone. So there are it's interesting because these communities are starting to form. And then there's a group of the public schools in the area that are all going to be using the platform. I started a course last week that's open, and it's also for teachers, on active learning. How do you do active learning from home, which is a very challenging. It's again having to like explain all of these things that we keep repeating, and now we actually have people listening to that. So let's step it up. But we have, you know, mixed messages. We have it's just very complicated to organize the mindset. We also felt like the first few days that kids were at home, that they weren't online yet, they were still, you know, parents were adapting. And last week it was a good week. We ended the week with all parents thanking us, all parents, and we have 80 students. It's not that much because it's the beginning of the school, but it was very nice to have the teachers, the community engaged. This week we can feel a little bit of the depression coming in. So that's kind of what, and then the students are sending in some of their work, and you can see how they're starting to get more lonely. And as the scenario increases here, the estimate now is that schools are going to be closed at least until April 30th, which is another month. It should probably be until mid-May at least. Then I think everybody's everybody's stamina dove down. And I imagine you guys are a little bit ahead of us in this curve. So
Right.
I think, I don't know, I have so many more things to tell you. What we decided to do, we ended up doing connection first. So maybe that's a good principle to end, which is for our distance learning, knowing that we still didn't have everything ready, that we didn't have the behaviors, that this is the beginning of our school year, of a new school, of a new group of students. Our first premise was connection. So we asked the teachers, even though they were scared, we asked them to meet their students twice a day for brief 10 minutes. So they have the link. We're going to teach them during these meetings, not only how we're going to do things, but they'll actually run a morning meeting, and they'll do a checkout afternoon meeting too, so that the kids are not going out the whole day, and that their day also has a semblance of time, because what happens with kids at home is that just doesn't happen. It ends up being on the parent to do it. We also asked the activities to be a lot of them self-directed, some of them that they would make videos, some of them that they would send feedback, and not to have a specific deadline for all of them to finish, because that was generating anxiety. And we had every parent talk to their teacher for 20 minutes last week, just about life. So it was just basically, let me know how I can support you. Let me understand it's all okay. We're going to get through it. Be kind to yourself, and let's move. And we also are doing, and this was tough, we're doing daily meetings with teachers, with the whole 45 teachers in the school. They're all coming in at 4 p.m. and we have a 1-hour meeting. We brought some people from TC to help us with training. So we did 2 trainings, and they are like, it's a mess. The whole world is a mess. It's like, yes, but we have to keep our minds moving, our minds curious, because the only way to get out of this darkness is if we're curious. We don't need to be happy, but we need to continue to be curious. We need to continue to be learners. And it worked great. Yesterday we did we had meetings throughout last weekend, and the teachers used the time to go over and say how they're feeling. Some of them were angry, some of them were frustrated, some of them were saying that they felt like we were just bulldozing over them. And then by the end of the week, a lot of them were like, well, I'm glad I persisted. I'm glad you guys helped me, because now I know how to post something on Google Classroom. And they're I think as an administrator, there is a big burden on us to support that first war zone frontline that they're feeling. So that's kind of how I felt last week. I was like, I'm borrowing a little bit more authority than I usually do, but I really think that we should try this, and really think that we should coordinate this, and it worked.
That's great.
That's it. Sorry, I talk a lot.
Great.
I miss you guys.
Thank you, Leticia. We're so grateful for your experience, and I think you share just that feeling that we all did at the onset of this, right? Like the just overwhelming nature of emotion and the rushing anxiety. And I've seen articles that really liken this experience to the stages of grief. And the articles that I've read, or people's personal accounts, sort of document their weeks and as it goes on. And I think, oh yes, this is where I am. I'm in, week 2, and I am really anxious right now. And, then we've heard from some of the others. And I know, Juhi, you sent me a really positive email about sort of being maybe further along in the curve and how you're maybe feeling hopeful again. And so I was wondering if those of you in the call, especially from Kevin and Juhi and Vasily, a little bit now that the tide is turning, what sort of advice do you have for us? What sort of words of hope can keep us curious, keep us strong, and help us stay the course?
I could start. I could say, don't overthink. Even if people that are dear to you caught the virus, I mean, even this could happen. Just keep with your daily routine. As you were saying, if you need to bulldoze, borrow extra authority, because at these times, soft bulldozing, I think, is only encouraged, because it helps people to snap into shape sometimes. and be positive and look for opportunities like what Leticia just described. Sounds like a huge opportunity for the distance learning part, which I was always excited ever since I took the course at Teachers College on distance learning in 1994. So,
Juhi, anything you'd like to add?
Okay, I wanted to briefly three things. First, I think the keeping the balance physically and emotionally is very important, which means they focus on the daily life and being united with family, friends, communicating, and also like today, with alumni. So I'm so proud of, I studied at Teachers College. It's really global environment. But I think, this kind of work should go on because we are hearing the news, CNN and the Korean news. But this is the real story, right? So it's more than, the encouraging and the more than relieving because everybody's working so hard. And also the good thing about this situation is that the virus is the spreading is the timing is different. So we can tell, oh, it's passing, it will pass. Oh, they survived like that. So I think exchanging information and emotional encouragement is very important. So that's one thing. And the second one is that I think online environment, I think that's a very new topic we have to think about and share to make a better place. Between the 2002 up to 2009, I was staying in Korea. I had to take online courses because my husband had to serve the army in Korea. Right. I had to go back, come back from the States. That time I had to take the online courses. So online course distance learning environment, it's a good, the chance for the people cannot continue the work and study. So, but also there's a side effect too. So we can keep, talking and develop the better way. And the last one is that there's a Chinese word, 지피지기 백전백승, which means if we know the enemy and ourselves first, and then we will win 100 times over 100 battle. Yeah, that's it.
Great, thanks, Juhi. Kevin, any thoughts? Words of advice?
So in Chinese, we say, whenever there's a crisis, there's always new opportunity you can find in the crisis too. So I feel like for us as a school, like our alumni mentioned, that we also see this as a good chance to improve our online learning model, which we have been using since the breakout of the virus. Teachers are using the software Zoom to do online teaching. Live teaching sessions to students, and using Manage Back, Start Park. We're trying to do our best to give students the best online learning experiences. So I'm hoping that all our alumni could stay safe, stay calm, and be able to think and be able to find their opportunity within this crisis.
Thank you, Kevin. We hope the same. So for Jeffrey or Joanna or Leticia, are there any questions or concerns or even, silver linings or hope that you've been able to find in this situation? Or maybe even you might tell us, what do you think Teachers College can do to help support alumni in this time?
I would say that, it's cliche to use the phrase that not all heroes wear capes, but there's heroes all over the place. And I think a lot of people are stepping up to be heroes for students, and certainly our healthcare workforce. Our students were ready to volunteer on day one to jump in and help, and we had to hold them back because we're like, wait a minute, we have to make sure you're safe first. But there are just heroes all over the place, and it is such an incredible, gratifying thing to see that. And I think holding gatherings of alumni maybe that aren't focused on COVID-19 might be a good thing to do, to let people focus on something else, online learning. Are you going to be able to hear now how to improve your career? Maybe not, but you might want to think about things, and there are experts out there within our over 90,000 alumni that that are willing to go out and do that and do these kinds of online sessions. And I think those are a good thing.
Absolutely. Thanks. That's a great suggestion. And
That's actually for TC, it's a good opportunity. Like here at WEC, for example, we get at least every couple of days an email saying, okay, you work, but you should also invest in yourself. Now is the good time. This is a good link. This is a free course. This is a free museum trip. So I don't know what TC is doing. I'm sure it's something is on the back burner, but that would
absolutely. Being Teachers College, we jumped right in there as well, and we've actually launched. So on our homepage, there's also a preparedness website that has been giving constant updates. But one thing that we added to that was another page that's called Coming Together. And it really has a lot of resources for parents, for teachers to take their content online, as well as live opportunities and other virtual opportunities to connect over the course of this experience. And so we'll continue to add to that, continue to build programs. We are looking for alumni with expertise. So if you know of anyone that's interested, we'll make sure that that's more visible on the website, a link to submit a proposal for what kind of virtual program someone might be interested in presenting. So certainly those are things that have already begun and will certainly continue. We have a monthly career webinar, and those are also archived. So there is a lot of content that's available. Our next one will be in 2 weeks and another in May, but we will continue to add in virtual programs. And certainly, of course, from my perspective, we love to feature TC alumni doing what they do best, sharing their expertise with the community. So we'll certainly look for more ideas and continue to build that. Or Leticia, anything else to add or share?
I love the idea of sharing, having meetings like this. I think that even, like we had so many experts. That's one thing we were talking about at the Alumni Council meeting, is maybe we can just, create a channel where you can volunteer. Like, I'm teaching all these classes now on active learning, and it would be great. I could just go in and whoever is interested, that could be a way of checking in, knowing that you're talking to your TC community. I think it's a really great chance. So I would love that. If any of you would like to speak to my teachers, I'm sure that they would feel very important and very connected, just by being in contact with people that are all over the world. Like Juhi said, it will help you see the curve. It will help you see where you're going to, and be able to look at this as a connection opportunity. So I really like it, and I think it can work. We have Zooms, we can record sessions, I'm sure that people would love to help teachers. We wear no capes, but they're pretty visible right now.
Absolutely. Couldn't agree more. So Joanna?
Yeah, thank you. And thank you again for bringing us all together. I guess just some of my final thoughts about this is that it's been said, we're all in this together, and everyone has challenges on different levels. Their day-to-day routines and what their days look like have different highs and lows, and we're celebrating together and also sharing what's working, maybe what our challenges are. Something that's been really great in my mother community, teaching community, just in general, is just sharing resources. And it feels like a lot to take in, but do what works for you and what you feel suits you and your family and your children. So thank you again.
Absolutely. Thank you all so much. I'm really just overwhelmed with gratitude to each and every one of you for sharing that sense of TC pride, for wanting to pitch in even when you're already taking on so many jobs at home and on your homework front. And we're just really grateful to have you all as TC alumni, making an impact all around the world and continuing to just do great things every day. And we couldn't agree more. You're all our heroes right now, and you're helping to change the world, shape the world. And I think Leticia had such a beautiful point. We have to remember to be kind to ourselves and to one another. So just with extreme gratitude, thank you so much for being part of this call. Y'all are amazing.
Thank
Thank
you.
you.
Thank you.
Rosella. Thank you all.
If I could
Thank
do
you,
a
Rosella.
Thank you.
I think
Bye.
this is-
Wonderful.
Don't come close. Yeah, the virus.
Yes.
Yes, we're all at least 6 feet apart. Stay active.
Stay at home.
Stay at
Yeah.
home.
You too, Rosella. You too. Yeah, everyone. Bye.
Bye.
Thank you so much.
Bye.
Bye.
Bye, everyone.